family students, Mr. Yance again. Day 3 of notes. I want to kind of go over, I want to go over how to do adult CPR. I mean, that's what what notes is about. Talk a little bit about choking and what we do with the Heimlich maneuver. Talk about, how to recognize symptoms of strokes and heart attacks and cardiac arrest. Now we're going to kind of put it all together. So this video kind of goes through the informational part of doing CPR and why we do it. And then I have another video. I talked about this the other day. It's actually on there with the Heimlich maneuver. It's all in the same video. I'll put it back on there again that I demonstrate how to do this. So this is really important you watch both videos, okay? So adult, you have an unresponsive victim. You've made sure the scene is safe. You've yelled for help. You called 911. You've tapped them on the collarbone and yelled at them. Are you okay? You don't see any movement. You don't see any blinking. You don't see any coughing. What do I do? Okay. Now, with an adult, if you're alone and you don't have access to a phone, you have to go get it. You actually leave them. We talked about this the other day. Go get your phone, come back, get 911 call because they probably have a clogged artery. You're probably not going to fix that. Okay. We need to get EMTs coming and the hospital coming. And then, you've looked, listened, feel, there's nothing. If there's a crowd, you don't have to worry about this. You just point to somebody and say, call 911, have someone go get an AED if it's available. And then we're going to start looking at, what do we do next? Okay. You got to get them on their back. That you can't do CPR with them face down. So if they have to be on their side or face down, you got to roll them onto the back. If you think there's a head or neck injury, you got to be super careful. You got to support their head and neck and roll them like a log as one unit, body and head and neck all as one. If you're going to breathe into them, you do a head tilt 10 lift. You put 2 slow breaths in. You watch the chest rise and fall twice. If they have a head or neck injury, you see notes on here about a jaw thrust. I would not mess with that. You got to be trained how to do that. And there's no point. Chest compressions is what we really are emphasizing anyway. So, if you think there's a head or neck injury, just skip that part and start with chest compressions, okay? So we've done all of our, you can read some more there on the screen. We check. We don't see any chest coming up and down. We don't hear any breath sounds coming out of them. We don't see any signs of life. There'll probably be a kind of a grayish, whitish complexion to them. That's something that we do. Now, by the way, let me show you something real quick. Let me pause this for a second. Okay, this is what we call a barrier device. Hopefully you can see it there. One-way valve, so you don't have to worry about anything coming back at you. It fits very well right here on the nose. It makes a nice seal. These are awesome to have. I have one in my vehicles. I have one here at school. They even have the same valve. Can go on a child mask as well. If you have one of these, it takes all the guesswork out. I would go ahead and breathe into them if you have a barrier device. It's just a good thing to have. If you don't have one of those and it's a stranger and you don't know them, I probably would not breathe into them. I go straight to chest compressions and skip the 2 slow breath parts of this, okay? You only want to take about 10 seconds to analyze them. I know that sounds really, really fast, but we don't want to waste time. We talked about we only got 4 minutes, and then they could have brain damage, and we don't know how long they've been laying there possibly. So we got to act fast and quickly. I know 10 seconds sounds like a really fast time to assess, but we have to. And that, by the way, that's a good test question. Okay. So we have no signs of circulation. If signs of circulation are present, but they're gasping, they're having hard time breathing, maybe drowning, smoke inhalation, we do something called rescue breathing. If we have one of these again, and we put one breath every 5 seconds, 5 to 6 seconds in an adult. Okay. So let's say for argument's sake that we got nothing. They're pretty much dead. And we need to start CPR, okay? I'll go through the steps. Watch my demonstration video. It's really important that we watch that because I show you how to do this on that video. I didn't want to make myself bigger there. My fault. Trying to move myself down. Get here. There we go. Here's the deal. Okay. So we got them on their back. That's first thing. Okay. Quickly moving any clothes out of the way. You don't have to have a bare chest like the video shows there. If they have a shirt on, it's fine. Chest compressions will work. If they got a big bulky coat on, then you probably want to take that off. Okay. You want to put the heel of one of your hands, whichever hand's your dominant one, right over the lower half of the breastbone. You can see right between the nipple line. That's what we use as a guide. You don't want to get too down too far. We don't want to break that xiphoid process off. And if you get too high, you got the clavicle in the way. So you want to be right between the nipple line. Okay. You want to push down straight at least 2 inches. Now, I know the rate is 100 to 120 compressions per minute. We've argued with our supervisors for years on that. We're not going to get that. But they still left that in there because that's 1.5 a second. You don't want to do it that fast. You want the chest to pop back up after each compression. And you want to do 30 of those. So it doesn't matter if we're talking about an adult, child, or an infant. 30 compressions, 2 breaths. 30 compressions, 2 breaths. That's what we call a cycle. Okay. The biggest thing is, and I show this on the demonstration video, don't bend your elbows. Make sure you're looking straight down at your hands. And you want to give effective chest compressions. Okay. If someone else knows CPR, you can take turns and switch off because you're going to get tired. The biggest thing is I have a demonstration dummy, what we call a feedback, shouldn't call them dummies, feedback response mannequin. There you go. I got to use the right word. If you guys are virtual students and you want to come in, you want to get a CPR certification, and I'll get you a card. It costs you $2. That's it. It's a pretty good deal. You need to come in and show me you can do that on that demonstration feedback mannequin, because it actually lights up if you go deep enough. It lights up if you go at the right rate. Okay. The biggest thing is you want to make sure that I think this is kind of funny. It says go 2 inches, but not more than 2.4. I'm not going to sure you're going to know if you want 2.4. But that feedback mannequin really demonstrates that, and I show that on the video. You can see what I'm talking about. If you're not putting breaths in, I would go 30 compressions. Count them out loud. 1, 2, 3, 4. And then you might take just a second to catch your breath, because that's normally what you would do if you were putting breaths in anyway. And then you go right back at it again. And there's no set number. You're going to do as many of them as that you can, either until the AED gets there, EMTs get there and take over, or they magically they revive. Okay. Probably not going to happen, but that's always possible. Okay. And there's some more about CPR approach. I already talked about that. It's just a good thing to do. The AED takes precedent. If it shows up, you want to use it. Okay. We'll talk about the AED next set of notes. What am I looking for signs of life? Body movements, coughing, return to normal breathing, or arrival of the AED or ambulance. That's your sign that you're done doing compressions. You're just going to keep doing them until those happen. Okay. If they would magically, come around, I doubt it, but just in case, you can lay them on their side. If they have a head or neck injury, do not do that. But if they have no trauma and they seem to be okay that way, then you want to roll them on their side and let them they breathe a little easier. Let me show you a quick video on that, and you can see what I'm talking about with that. All right.
In this video, you will learn how to put a victim into the recovery position. The recovery position is used for unresponsive adult victims who clearly have normal breathing and effective circulation. This position is designed to maintain an open airway and reduce the risk of airway obstruction and aspiration. The victim is placed on his or her side with the lower arm in front of the body. Extend the lower arm above the head and rolling the head onto the arm while bending both legs. The position should be stable, near a true lateral position, with the head dependent and with no pressure on the chest to impair breathing.
Okay, so you can see, just roll them on their side. You don't have to if they, you think they got some trauma, don't do that. But I mean, it just helps them breathe easier. Okay, and probably, I shouldn't say, but most of the time that's not going to happen anyway. Okay, CPR is not a hard technique. Anybody can do it. I've trained thousands and thousands of people over the years, and all of them's been able to demonstrate they could do it. But doing it on a mannequin and doing it in real life is two different things. And the biggest thing I really want to emphasize to all of you is I want all of you to have confidence that, I can do this if I'm in an emergency situation, and that's the only thing that's the only I'm the only person there. Okay. Last thing, kind of wrap up CPR, and then I'll talk about the AED next set of notes. Pediatric chain of survival, a little different. Prevention of injuries is in there. We talked about how you phone 911 unless you are by yourself, and then you actually do CPR on them first. The other links are the same. Really, there's no difference in a child. What is a child? You'll love this, but it's anybody from 1 to puberty, so you got to use your judgment there. I don't know how you tell if someone's in puberty, but you just got to look at their body size, and really the only difference is I'm either going to use one hand or two hands. I'm going to skip through the prevention of injuries. Everything else the same, 30 compressions, same hand position. Really the only difference is if it's a small little 5-year-old or 4-year-old, I probably just want to use one hand to press down. My mannequins are set. You can see the difference because you don't have to push down as far on a child because they have more cartilage. And there you go. You just want to use one or two hands depending on the size of the child. You still want to do about 1/3 the depth of the chest, which is still 2 inches, just like an adult. You just don't have to press down quite so hard, especially on a young child. Okay. Really nothing else is really that much different. And I show that on the video as well. Okay. Everything else the same, 30 and 2. If you're doing rescue breaths, you do them a little bit quicker in a child, 1 every 3 seconds instead of 5 to 6. Okay. If it's an infant, a little bit different. We changed this a little bit, and I don't know if I show that on the video, but I'll explain it here. You can use 2 fingers, middle 2 fingers or first 2 fingers, because a baby, you don't have to press down nearly as far either. And the other thing is, if you put breath in a baby, their lungs are about like that. You just want to put a cheek full, just a little a puff, because you can blow their lungs out. You can use 2 thumbs. You place your hands around their body and you push down with your 2 thumbs. That's another technique that they say works. Okay, or you can do one hand, but I would probably do 2 fingers or 2 thumbs. That's my recommendation, because the babies are so tiny and you don't have to press down nearly as far on them. Okay, so in summary, pretty much the same. For a child, an infant, and an adult, as far as 30 compressions, 2 breaths. Only difference is I don't put as big an air breaths in an infant. I use 2 fingers or 2 thumbs on a baby, 1 hand if it's a small child. Everything else is 2 hands. Okay, everything else is in play. Nothing else really changes with that. I have some videos. I will put this online. You can look at it. There you can see the 2 thumb technique and the 2 finger technique. And I do show that on the video, and I might redo that video too. AED we'll talk about next set of notes. So hopefully that makes sense. And as always, shoot me an email if something doesn't make sense, especially with this stuff. All right. Hey, have a great day, and we'll talk to you later. See you. Bye.